Sleep and dreams for better cardiovascular health. Sleep is a vital, cyclical process comprising light sleep, stages 1 and 2, deep sleep, stage 3, or slow-wave sleep, and REM, rapid eye movement, sleep, each serving distinct functions essential for physical, mental, and emotional health. Lucid dreaming, where individuals gain awareness and control within dreams, occurs almost exclusively during REM sleep, and is celebrated for its psychological, creative, and therapeutic potential. Hemi-Sync, developed by the Monroe Institute, uses binaural beats to synchronize brain hemispheres, potentially facilitating entry into hypnagogic states that serve as a functional gateway to REM sleep and lucid dreaming. Monroe Institute, ND. With over 50 Hemi-Sync exercises across series like Gateway Experience and Metamusic. Some show documented benefits in stress reduction, pain management, and cognitive enhancement, potentially supporting cardiovascular conditions like heart failure, HF, and hypertension. However, rapid transitions to REM-like states could theoretically reduce deep sleep if not timed properly, raising concerns for overall health in cardiovascular patients. Effects of binaural beats vary between individuals, and not all people experience brainwave entrainment. Crucially, lucid dreaming exercises should complement, not replace, regular 7-9-hour sleep to maintain sleep stage balance. This article explores sleep stages, lucid dreaming, Hemi-Sync's role, specific exercises, their implications for HF and hypertension patients, including considerations for sleep apnea, and strategies to optimize benefits while preserving full sleep. Understanding the stages of sleep. Sleep cycles, lasting approximately 90 minutes, repeat 4 to 6 times per night for adults getting 7 to 9 hours of sleep. Walker, 2017. Each cycle progresses through non-REM stages, 1, 2, and 3, before entering REM sleep. Stage 1, N1, light sleep, a brief, 5 to 10 minute, transition from wakefulness to sleep, marked by slowing heart rate, breathing, and brain activity, theta waves. It features fleeting hypnagogic imagery and is easily disrupted. Stage 2, N2, light sleep lasting 20 to 30 minutes per cycle, this stage involves further relaxation, with brain activity showing sleep spindles and K-complexes, preparing for deeper sleep. Stage 3, N3, deep sleep/slow-wave sleep dominating early cycles, 20 to 40 minutes, deep sleep features slow delta waves. It supports tissue repair, muscle growth, immune function, and brain waste clearance via the glymphatic system, critical for cardiovascular health. Fultz et al., 2019. Adults need 1 to 2 hours, 15 to 25% of sleep, nightly. Percentages may decrease with age. REM sleep, occurring about 90 minutes into the first cycle. REM sleep involves vivid dreams, rapid eye movements, and wake-like, fast, desynchronized brain activity, including beta and gamma bursts, sawtooth waves, and some theta. It fosters emotional processing, memory consolidation, procedural skills, and creativity, comprising 1.5 to 2 hours, 20 to 25%, of sleep, with longer periods later in the night. Walker, 2017. Both deep sleep and REM are essential. Deep sleep restores the body, while REM supports mental and emotional health. Imbalances can lead to fatigue, cognitive deficits, or cardiovascular strain, particularly for HF and hypertension patients. Walker, 2017. Lucid dreaming and its connection to REM sleep. Lucid dreaming occurs almost exclusively during REM sleep, leveraging high prefrontal cortex activity to enable dream awareness and control. Voss et al., 2014. Later sleep cycles, with extended REM periods, 20 to 40 minutes, are prime for lucid dreams, especially in the morning. While rare instances of lucid dreaming in non-REM sleep have been reported, these typically occur during stage 1, N1, sleep onset transitions, hypnagogic lucidity, not deep sleep, N3. True N3 lucidity remains unconfirmed in PSG studies and is considered exceptionally rare or debated, Stumbries et al., 2012. Lucid dreaming is advocated for psychological benefits. It reduces nightmare distress, aiding emotional processing, as seen in imagery rehearsal therapy, IRT, for PTSD, Krakow and Zadra, 2006. Cognitive enhancement. It supports creativity, problem solving, and skill rehearsal, e.g., athletes practicing moves, via REM's memory consolidation role, Stumbries et al., 2016. Personal empowerment. Dream control boosts confidence and allows subconscious exploration. Scientific interest. It offers insights into consciousness, Voss et al., 2014. Techniques like mnemonic induction of lucid dreams, mild, or wake back to bed, WBTB, target REM, requiring practice but accessible to many, Stumbries et al., 2012. For HF and hypertension patients, reducing stress and nightmares could theoretically improve cardiovascular outcomes, though direct evidence is lacking, Ulmer et al., 2018. Recent discussions highlight lucid dreaming's impact on brain function and emotional health, but no new links to cardiovascular conditions were identified, e.g., no studies post-2022 directly tying it to HF or hypertension outcomes. Hemi-Sync and transitions to REM-like states. Hemi-Sync delivers binaural beats, different frequencies in each ear, e.g., 100 Hz and 104 Hz, creating a 4 Hz beat, to entrain brainwaves toward theta, 4 to 8 Hz, or low alpha, 8 to 12 Hz, states, promoting relaxation and hypnagogic states that serve as a functional gateway to REM sleep and lucid dreaming, Monroe Institute, ND. For lucid dreaming, Hemi-Sync induces a mind-awake, body-asleep state, focus 10, which mimics REM's paradoxical phenomenology, mental alertness with physical paralysis, but does not replicate its full EEG profile of fast, desynchronized, wake-like activity, including beta and gamma bursts alongside theta, Sadai, 1990, Voss et al., 2014. However, effects vary. Not all individuals experience entrainment, and responses depend on frequency and personal factors. Hemi-Sync may subjectively facilitate transitions to hypnagogic or REM-like states by speeding sleep onset. Theta frequencies align with stage 1, reducing sleep latency and progressing through light sleep, Garcia-Argibay et al., 2019. Facilitating hypnagogic states. It guides users into vivid imagery, a gateway to REM, enhancing lucid dream potential. Targeting REM-heavy periods, used during naps or WBTB, waking after 5 to 6 hours, it leverages longer REM periods in later cycles, Stumbries et al., 2012. Anecdotal reports suggest Hemi-Sync users enter dream states quickly, often within minutes during naps, Monroe Institute, ND. A 2019 meta-analysis found binaural beats improved relaxation and sleep quality, supporting potential REM access, Garcia-Argibay et al., 2019. Recent studies, post-2019, reinforce this. Dynamic binaural beats reduced sleep latency in 2024 proof-of-concept work, and 0.25 Hz beats shortened latency to slow-wave sleep in PSG-validated research, Ablin et al., 2024, Wang et al., 2024. Note, the 0.25 Hz beat falls in the delta/infraslow range, below 0.5 Hz, distinct from theta-based Hemi-Sync tracks, e.g., Focus 10. However, no polysomnography, PSG, studies confirm accelerated REM onset specifically. Claims of faster REM entry remain subjective or preliminary. Does shortening deep sleep pose risks? Rapid REM transitions via Hemi-Sync may reduce deep sleep, especially if used early or during short naps, bypassing stage 3. Deep sleep dominates early cycles, so disruptions could cut its 1-2 hour duration, Walker, 2017. However, Certain binaural frequencies, particularly in the delta range, may enhance deep sleep latency and quality, as shown in recent PSG evidence, Ablin et al., 2024. Notably, the 0.25 Hz beat studied falls in the delta/infraslow range, below 0.5 Hz, distinct from theta-based Hemi-Sync tracks, e.g., Focus 10, highlighting frequency-specific effects. Delta range beats may enhance N3, while theta range may bypass it if mistimed. Potential risks of reduced deep sleep. Physical health. Less deep sleep impairs tissue repair, muscle recovery, and immune function, increasing risks for obesity, diabetes, or weakened immunity. It also reduces brain waste clearance, linked to cognitive health, Fultz et al., 2019. Cognitive and emotional effects. Deep sleep supports declarative memory. Chronic reduction may cause memory issues, fatigue, or irritability, Walker, 2017. Cardiovascular implications. Deep sleep promotes vasodilation and lowers blood pressure, critical for HF and hypertension management. Reduced deep sleep may increase sympathetic activity and stress hormones, exacerbating these conditions, Fultz et al., 2019, Walker, 2017. Severity. Occasional reductions, 1 to 2 times weekly, are unlikely to harm, as the body prioritizes deep sleep later. Chronic disruption. Nightly hemisync or less than 6 hours sleep, risks deep sleep debt, particularly for cardiovascular patients, Walker, 2017. Balancing REM and deep sleep. Hemi-Sync enhances REM-based lucid dreaming, supporting emotional and cognitive health, but deep sleep is vital for physical restoration. Both are necessary, and imbalances affect overall and cardiovascular health. Key factors include: sleep duration. 7 to 9 hours ensures adequate deep sleep before Hemi-Sync, Walker, 2017. Frequency. Limiting Hemi-Sync to 1 to 3 times weekly prevents deep sleep loss. Timing. Using Hemi-Sync during naps or WBTB targets REM-heavy periods, preserving early deep sleep, Stumbries et al., 2012. Why lucid dreaming exercises should complement regular sleep. Lucid dreaming exercises, including Hemi-Sync, should be used in addition to, not as a replacement for, regular 7-9 hour sleep to maintain the balance of deep sleep and REM, especially for HF and hypertension patients. Replacing regular sleep with lucid dreaming sessions, e.g., short naps or frequent WBTB, risks disrupting sleep architecture, particularly reducing deep sleep, which can exacerbate cardiovascular and overall health issues. Rationale for complementing regular sleep. Preserving sleep architecture. Full sleep, 7 to 9 hours, ensures 1 to 2 hours of deep sleep, early cycles, and 1.5 to 2 hours of REM, later cycles, supporting physical restoration and emotional processing, Walker, 2017. Replacing sleep with lucid dreaming exercises, which prioritize REM, may skip early, deep sleep-heavy cycles, leading to a deep sleep debt, Fultz et al., 2019. Cardiovascular health. Deep sleep promotes vasodilation, reduces blood pressure, and lowers sympathetic activity, critical for HF, tissue repair, fluid regulation, and hypertension, blood pressure control, Fultz et al., 2019, Nakajima et al., 2020. Chronic deep sleep reduction increases stress hormones, e.g., cortisol, worsening HF symptoms, e.g., edema, and hypertension control, Hayashi et al., 2022. Cognitive and emotional risks. Insufficient deep sleep impairs memory consolidation, increases fatigue, and elevates anxiety/depression, prevalent in 20 to 40% of HF and 30 to 50% of hypertension patients, Walker, 2017, Nakajima et al., 2020. Lucid dreaming stress reduction benefits, e.g., via nightmare relief, require full sleep to avoid counteracting effects, Stumbries et al., 2012. Hemi-Sync's impact. Theta-based Hemi-Sync tracks, e.g., Focus 10, may hasten entry to REM-like states, potentially reducing deep sleep if overused or used in place of full sleep, Garcia-Argibay et al., 2019. Recent evidence suggests delta-focused beats may enhance deep sleep, Ablin et al., 2024. Short naps or WBTB can target REM, but regular sleep is needed to maintain stage 3 duration. Evidence supporting supplemental use. Hemi-Sync studies, a 2017 RCT, N equals 74 veterans, found 30-minute theta-based Hemi-Sync sessions increased parasympathetic activity, reducing stress without replacing sleep, suggesting supplemental use for cardiovascular patients, Ballin et al., 2017. Lucid dreaming research, WBTB and mild are most effective when timed for late REM cycles, e.g., after 5 to 6 hours, preserving early deep sleep, Stumbries et al., 2012. Naps with Hemi-Sync, e.g., Focus 10, can induce lucidity without significant deep sleep loss, Garcia-Argibay et al., 2019. Sleep science, chronic sleep deprivation, less than 6 hours, reduces deep sleep and REM, worsening HF and hypertension outcomes, Walker, 2017, Nakajima et al., 2020. Supplemental lucid dreaming maintains full sleep duration. Effectiveness of specific Hemi-Sync exercises. The Monroe Institute offers over 50 Hemi-Sync exercises across series like Gateway Experience, Waves 1 to 7, Metamusic, Mind Food, and specialized tracks. While many lack large-scale trials, several show documented results or promising potential, particularly for stress reduction, pain management, and cognitive enhancement, with indirect relevance to HF and hypertension. Below are key exercises with evidence. Anecdotal claims, e.g., heart sync and circulation tracks, are noted separately. Tracks are grouped by primary sleep stage target, deep sleep versus REM/lucid dreaming, for clinical clarity. One, tracks that enhance deep sleep, N3, delta dominant. Track. Series. Frequency. Mechanism. Evidence. Sleeping Through the Rain. Metamusic. Delta, 0.5 to 3 Hz. Guides into slow-wave sleep, increases N3 duration and stability. Meta-analysis, delta beats improve sleep depth, Garcia-Argibay et al., 2019, user reports of deeper rest. Delta sleep. Mind Food. Pure delta, 1 to 3 Hz. Shortens latency to N3, ideal for bedtime use. PSG validated, 0.25 Hz delta beats reduced N3 latency by 30% during naps, Ablin et al., 2024. Deep 10. Gateway Experience. Delta plus low theta. Progressive descent into restorative sleep. EEG, increased delta power, user logs show improved recovery. Best use, bedtime, 10 p.m., to secure 1-2 H of deep sleep in early cycles. Ideal for HF patients needing tissue repair and fluid regulation. 2. Tracks that support REM sleep and lucid dreaming, theta dominant. Track. Series. Frequency. Mechanism. Evidence. Focus 10. Gateway Experience, Wave I. Theta, 4 to 7 Hz. Mind Awake, Body Asleep, Hypnagogic Gateway to REM. EEG, Theta Synchronization, SEDAI, 1990, 60 to 70% lucid dream success in WBTB, Monroe Institute, ND. Focus 12. Gateway, Wave 2. Low theta/high alpha, 6 to 10 Hz. Expands awareness, bridges to REM onset. Anecdotal plus EEG coherence, Foster, 1990. Free Flow 12. Gateway Experience. Theta/alpha blend. Sustains vivid REM-like imagery. User reports of creative dreaming. Lucid Dream Series, Dream Seed, Lucidity. Specialized. Theta, 4 to 8 Hz. Direct induction of lucid REM. User surveys, high lucidity rate within 1 to 3 uses. REM sleep. Metamusic. Theta plus light beta. Extends REM duration in later cycles. Anecdotal, designed for late-night use. Best use, WBTB, wake after 5, 6H, play 20 to 30 minutes, or afternoon naps, 20 to 90 minutes. Avoid at bedtime may reduce early deep sleep. 3. Stress reduction and autonomic nervous system balance. Unspecified theta binaural beats, post-exercise recovery. Description: theta frequency tracks, 4 to 8 Hz, promote relaxation post-exercise. Results: increased parasympathetic activation and sympathetic withdrawal, accelerating heart rate and blood pressure recovery. Potential for stress management in HF/hypertension patients, Lewis et al., 2019. Evidence level: moderate, single study, small n. Binaural beats in music, post-deployment stress. Description: 30-minute nightly tracks for veterans, blending music with Hemi-Sync. Results: double-blind RCT, N equals 74, showed reduced sympathetic activity and increased parasympathetic responses via HRV, lowering stress over 4 weeks. Relevant for HF/hypertension by reducing cardiovascular strain, Ballin et al., 2017. Evidence level: strong, RCT, published. Dynamic binaural beats, recent edition. Recent 2024 proof-of-concept study showed reduced sleep latency and potential quality improvements, supporting stress reduction, Kim et al., 2024. Evidence level: preliminary. (4) Pain management and surgical analgesia. Intraoperative Hemi-Sync signals. Description: unspecified tracks used during surgery to reduce painkiller needs. Results: double-blind trials, bariatric/lumbar surgery, reduced fentanyl requirements by 33%, 0.015 versus 0.024 μg/kg/min, p equals 0.009, with no sedation impact. Potential to lower perioperative stress for HF patients, Lewis et al., 2004. Evidence level: strong, replicated RCTs. Radiation oncology tracks. Description: unspecified binaural beats for cancer patients. Results: pilot study, N equals 16, reduced fatigue and pain, 87.5% found it effective. Relevant for HF patients with fatigue, but not cardiovascular specific, Padmanabhan et al., 2005. Evidence level: preliminary, pilot, open label. 5. Electrocortical synchronization and consciousness. Focus 10 and Free Flow 12, Gateway Experience. Description: foundational exercises inducing mind awake, body asleep, Focus 10, and deeper awareness, Free Flow 12. Results: EEG studies showed hemispheric synchronization, theta/alpha, enhancing relaxed focus and lucid dreaming potential. Users reported sustained effects without audio. Promising for cognitive enhancement and stress reduction, Sadai, 1990, Foster, 1990. These are institute-affiliated and preliminary. Evidence level: moderate, EEG-based, institute-affiliated, limited replication. Gateway experience waves 1 to 7. Description: progressive tracks, e.g., Focus 10, 12, 15, 21, for meditation and altered states. Results: EEG data confirmed altered arousal and attention, with anecdotal reports of enhanced learning. Potential for emotional regulation in cardiovascular patients, Foster, 1990. Evidence level, moderate, lab studies, limited replication. Six, sleep, learning, and memory. Beta frequency tracks, e.g., concentration. Description, beta focus tracks for focus and memory. Results, double-blind study, N equals 50 students, improved memory and attention tasks via hemispheric coherence. Useful for cognitive clarity in stressed patients, Kennerly, ND. Evidence level, moderate, double-blind. Anecdotal or unproven exercises. Heart-Sync and circulation tracks, designed for heart-centered relaxation and physical well-being, using theta/alpha frequencies. Anecdotal reports suggest reduced stress and improved mood, no clinical trials. Potential for HF/hypertension via relaxation, but unproven, Monroe Institute, ND. Lucid dreaming and cardiovascular conditions, heart failure and hypertension. Lucid dreaming and heart failure patients. HF, characterized by impaired heart pumping, involves sleep disturbances, nightmares, and anxiety, increasing hospitalization risk, Hayashi et al., 2022, Nakajima et al., 2020. Hemi-Sync exercises like theta tracks may help. Nightmares and HF. Up to 33% of heart disease patients report frequent nightmares, linked to 5 to 7 times higher odds of depression, anxiety, and insomnia, straining the heart via sympathetic activation, Hayashi et al., 2022, Nakajima et al., 2020, Nielsen and Levin, 2007. Potential benefits, lucid dreaming therapy, LDT, reduces nightmare distress and PTSD, potentially lowering cardiovascular strain via improved sleep and reduced anxiety, American Academy of Sleep Medicine, 2014, Stumbries et al., 2012, Zadra and Pill, 1997. Hemi-Sync stress reduction, e.g., veteran study, could support HF management, Ballin et al., 2017. Risks, WBTB or Hemi-Sync may reduce deep sleep, critical for HF recovery, Fultz et al., 2019. Intense dreams can elevate heart rate, risky for unstable HF, LaBerge and Levitan, 1995. Beta blockers may suppress REM, hindering lucidity, Harb et al., 2016. Promising exercises, theta tracks for relaxation, Focus 10 for lucid dreaming with minimal disruption. Additional consideration, sleep apnea in HF. Sleep-disordered breathing, including obstructive and central sleep apnea, affects 50 to 70% of HF patients and exacerbates symptoms through hypoxia, fragmented sleep, and increased sympathetic activity, Javahari and Redline, 2017, Summers et al., 2023. Untreated apnea can worsen HF outcomes and may interfere with lucid dreaming or Hemi-Sync by causing frequent arousals, reducing REM stability. Hemi-Sync manuals acknowledge apnea as a sleep issue, Monroe Institute, ND. Patients should screen for apnea, e.g., via polysomnography, and use CPAP therapy alongside techniques. Hemi-Sync during untreated apnea risks compounded hypoxia. Consult a sleep specialist for compatibility. Lucid dreaming in hypertension patients. Hypertension, driven by stress in 30 to 50% of cases, may benefit more from lucid dreaming stress reduction. Hemi-Sync's ANS modulation is relevant. Nightmares and hypertension. Nightmares increase hypertension odds by 42 to 56% via sympathetic arousal, Ulmer et al., 2018, Nakajima et al., 2020. Potential benefits, LDT reduces anxiety and cortisol, potentially lowering blood pressure by 4 to 10 mm of mercury, similar to meditation, Stumbries et al., 2012, Levine et al., 2017. Hemi-Sync's theta tracks, e.g., veteran study, enhance parasympathetic activity, supporting blood pressure control, Ballin et al., 2017. Risks: sleep fragmentation reduces deep sleep, impairing vasodilation, Foltz et al., 2019. Intense dreams may temporarily raise blood pressure, Laberge and Levitan, 1995. Medications may limit REM, Harb et al., 2016. Promising exercises: beta tracks for focus and relaxation, Focus 12 for deeper stress relief. Comparison of HF and hypertension. Hypertension patients may benefit more from Hemi-Sync stress reduction, as stress strongly drives blood pressure, Levine et al., 2017. HF patients face higher risks from deep sleep loss due to their need for physical recovery, Foltz et al., 2019. Both require medical oversight. Mitigating risks and optimizing Hemi-Sync use. To safely use Hemi-Sync or lucid dreaming techniques while protecting deep sleep and cardiovascular health. Ensure full sleep, aim for 7 to 9 hours nightly to secure 1 to 2 hours of deep sleep, critical for HF and hypertension recovery, Walker, 2017. Use lucid dreaming as a supplement via naps, 20, 90-minute naps with Hemi-Sync, e.g., Focus 10, target REM without significant deep sleep loss, Stumbries et al., 2012. WBTB, wake after 5 to 6 hours, use Hemi-Sync, e.g., theta or delta frequency track, for 20 to 30 minutes, then sleep 1 to 2 hours, Stumbries et al., 2012. Time strategically, target REM-heavy periods, naps or late cycles, to preserve early deep sleep, Stumbries et al., 2012. Limit frequency, restrict to 1 to 3 sessions weekly to avoid deep sleep loss, alternating with uninterrupted sleep. Monitor symptoms, track fatigue, heart rate, blood pressure, or HF symptoms, e.g., edema. Use wearables for sleep estimates, but consult specialists for accuracy. Enhance sleep hygiene, maintain consistent schedules, avoid caffeine/alcohol, and ensure a cool, dark environment, Walker, 2017. Combine techniques, pair Hemi-Sync with mild, dream journaling, IRT, or meditation for stress reduction, Krakow and Zadra, 2006, Levine et al., 2017. Consult professionals. HF and hypertension patients should consult cardiologists, especially with sleep apnea or medications, Harb et al., 2016, Javahari and Redline, 2017. Avoid in epilepsy, psychosis, or acute cardiac instability. Practical example. 10 p.m. to 6 a.m., play Delta track, e.g., Sleeping Through the Rain or Delta Sleep, secures deep sleep. Optional WBTB, wake at 4 a.m. play Theta track, e.g., Focus 10, for 20 minutes return to sleep enters REM-rich cycle. Or nap, 2 p.m. nap with Focus 10 or Lucid Dream series. Monitor blood pressure or HF symptoms. Conclusion. Hemi-Sync exercises like Focus 10, theta-based tracks, and dynamic binaural beats show promise for stress reduction, pain relief, and cognitive enhancement, potentially supporting lucid dreaming and cardiovascular health via parasympathetic activation, Ballin et al., 2017, Lewis et al., 2004, Kim et al., 2024. For HF and hypertension patients, reducing stress and nightmares could improve outcomes, but no direct studies confirm efficacy, Ulmer et al., 2018. Lucid dreaming exercises must complement, not replace, 7-9-hour regular sleep to preserve deep sleep, critical for physical recovery and blood pressure regulation, Foltz et al., 2019, Walker, 2017. Risks like deep sleep reduction or sympathetic arousal during intense dreams require careful management, especially for HF patients with sleep apnea, Laberge and Levitan, 1995, Javahari and Redline, 2017. By prioritizing sleep hygiene, timing exercises for REM-heavy periods, limiting frequency, screening for apnea, and seeking medical guidance, users can optimize benefits. Future RCTs on Hemi-Sync's impact on blood pressure, HF metrics, and PSG-validated sleep architecture are needed to validate its role. Note: consult a healthcare professional before using Hemi-Sync, especially for cardiovascular conditions or sleep disorders like apnea. References.